If you're Indian like me, you may have noticed that you're hearing more stories of Indians and South Asians having heart attacks in their 40s and 50s, and it feels like it's becoming more common, and that's because it is. The general population usually starts having heart attacks, at 55 to 65 years old. But we're now seeing that Indians and South Asians are having heart attacks about 10 years earlier, so in their 40s to 50s, and that's becoming more the norm. And that's for a few different reasons. One is, genetic predisposition, so what you've inherited from your family, unfortunately. And then the second is Indians and South Asians are more likely to have diabetes and prediabetes. They're more likely to have abnormal cholesterol levels, and they're less likely to exercise or be active in general versus the general population, as well as, kind of unhealthy diets, basically. Unhealthy eating. And so that can be either, the traditional diet, because some, Indian food is healthy, but some Indian food is really unhealthy. There's a lot of fried foods, which are high in saturated fat. And, depending on what you're eating, there can also be an excess amount of carbs, unhealthy carbs, and not enough protein. And so these are, a few different issues. But then, other Indians and South Asians fully embrace Western diets, which are also full of very unhealthy foods. If you go fully on the spectrum of processed foods and fast foods and packaged foods, that can be very unhealthy too. And so there's the two extremes there, but Indians and South Asians are more likely to have an unhealthy diet versus the general population. And so it's a combination of those things of why Indians are more likely to develop heart disease at a younger age versus the general population. But prevention still works. You just have to be more aggressive about it. And I'll talk about that more in my next video.